Hello, everybody. I see everybody's muting, unmuting, turning on and off their cameras. So I'm just going to give everybody a couple of seconds to settle in. I think we're okay. So it's 5:32 and we're going to start. Good evening, everyone. Anna Mikage, bonjour à tous. Thank you for joining us for our third webinar of our Planetary Health webinar series and Community of Practice. My role today is to provide you with the housekeeping remarks. Mon nom est Christina Laperle et je suis la liaison à du Bureau de l'Internationalisation de la Santé Mondiale. If you encounter any technical issues, our advice is to close all other applications on your computer, exit the webinar, and rejoin. I would like to begin today's session with our Indigenous land acknowledgement. We pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous people in the region from all across Canada who call Ottawa home. Nous reconnaissons les gardiens des savoirs traditionnels, jeunes et âgés. Nous honorons aussi leurs courageux dirigeants d'hier, d'aujourd'hui et de demain. Questions will be answered after Dr. Lem's presentation. You can type your questions in the chat or use the raise your hand feature. And please be aware that ce webinaire sera présenté en anglais. Les participants auront aussi la possibilité de poser des questions en français. Although I believe actually our translator has called in sick today, so we will do our very best to help with the French where possible. And now I would like to introduce Dr. Hussein Malou, our Director of Planetary Health at the Faculty of Medicine, and I will leave it to him to provide a brief overview of our Planetary Health webinar series and Community of Practice and introduce you to our speaker for today's workshop. Dr. Malou will also act as the moderator for today's Q&A session. And over to you, Hussein.
Great, thanks, Christina. So as you can see from the slide, we've set up a 6-part webinar series. And essentially, what we're hoping is to provide you with speakers who can inspire you and kind of lead you on the road to kind of getting engaged with the whole planetary health area. And if we go to the next slide, Christina. So I'll let Dr. Lem talk about her objectives. I'm sure she'll cover that during her presentation. So can we go to the next slide? So as part of this series, we wanted, it's such a big, daunting area, planetary health, and it's tough to know how to get involved. And honestly, when we were putting this together, one of the names that was very clearly there, if we could possibly get her to speak, was Dr. Melissa Lem. And the reason for that is, regardless of what area of planetary health you want to engage in, she's kind of done it. And she's a family physician. She works out of Vancouver, but it also works in rural and northern communities. She is the president of CAPE, and CAPE is awesome and does a lot of stuff. For those of you who are not aware of them, you should really check out their website. But lots of amazing campaigns, lots of advocacy work. And Dr. Lem is president of that. And not only is she president of that, but she's also director of Parks Prescription. And it's a really, really cool program. And I'm hoping we'll get a sense of kind of how she started that and built that, because that is super inspiring. And again, it's, because of all the stuff that she does, she's very clearly an international leader in this area. Not only does she actually do all that stuff, but she writes, and she's written for a whole bunch of different publications, ranging from CBC to the Toronto Star. She's a constant presence in any kind of media related activity where people are asking for opinions on planetary health. She was on CBC TV's hit show, Stephen and Chris. We were chatting before this, myself, Christina, and Marcia, before Melissa joined, but I think she's been in a few movies. Maybe we'll hear about that. She's won a bunch of different awards, and I'm not even gonna go into all that, but I could just go on and on about Melissa. She's awesome. We're really, really lucky to have her here today. I'm really looking forward to getting inspired further by her. And I'll stop talking because I think we'd really love to hear from you, obviously, Melissa. And I just want to, again, on behalf of, I mean, not only those of us here today, but those of us who are trying to get into this space, I just want to thank you for everything that you do. You really are inspirational. And again, welcome to our webinar series, and thank you for joining us.
Thanks so much, Hussein. That's probably the warmest and most over-the-top welcome anyone has ever given me. So thank you for that. It's actually a real pleasure for me to be speaking with you because I went to University of Ottawa for medical school and have really fond memories of walking to Roger Guindon with my eyes closed because it was so cold that the fluid on the front of my conjunctiva was freezing. Anyway, I still loved it. I had such a great time there and so many great memories. So like I said, it is great to be back. Okay, oops, here we go. I'm going to share my presentation here. And so, Hussein, you said that I was going to talk about my objectives. I saw that in the slides that you sent, so I actually don't have my objectives as part of my presentation, but I'll try to remember what they were. So we're talking about novel climate conscious approaches to clinical medicine with a focus on social prescribing and nature prescribing. And our objectives are to review a bit of the evidence base behind social prescribing and why connecting to nature and nature exposure and prescribing nature are good for our health. And then we're going to talk about ways that you can integrate nature prescribing into your own practice and just the overall benefits of biodiversity for personal health and planetary health. All right, so these are my disclosures. I give a lot of different talks, and in terms of the main relationship I have, it would be with the BC Parks Foundation in terms of a financial one. I did this work on a purely volunteer basis for a good 3 years, and then when it started to encroach on my clinical time, I started asking for a small stipend. Anyway, so I have a few small consulting fees from the BC Parks Foundation, but otherwise there are no real other major relationships to disclose. And this is how I'm going to manage my potential bias. All right, so I think the reason why it's so important to talk about social prescribing is because, as many of us know, the minority of what determines our health status does not come from our healthcare system, even though we all work in the healthcare system. Only 20 to 25% of our health status comes from that. And the rest of that, the other 75 to 80%, comes from factors outside of our healthcare system. And so when you think about the different factors that impact people's health, whether it's income, childhood development, employment or working conditions, food, housing, your air quality, and civic infrastructure. In fact, if we want to truly be making a difference for our patients' health on not just an individual level in our offices or our hospitals, because of course that's important, but arguably if we start taking action on these social determinants of health, then we could arguably have an even larger impact on their health. And so that's the whole principle behind social prescribing. And the WHO defines it as a means of connecting patients to a range of non-clinical services in the community to improve their health and well-being. And what this allows is providing more holistic and person-centered care. And it also empowers patients to take care of their own health and well-being, which reduces the overall stress on our health systems. We know that about 5% of Canada's carbon pollution comes from our healthcare system. And so anything that's going to improve people's health in a low carbon way, because often what we prescribe to people is it's a low carbon activity or a low carbon pursuit, that will also reduce the burden on the healthcare system and reduce overall carbon emissions. So that's why, again, it's a nice intervention with co-benefits that improves patient and planetary health at the same time. So in terms of social prescribing, there are sort of three main components. And the first component, it doesn't have to be a primary healthcare provider. It can certainly be, a specialist if you like. What they do is assess that patient's need for social prescribing. And then they refer them to a link worker, something that's traditionally within this social prescribing framework. And that person works with the patient to develop a personalized wellness plan and refers them to appropriate services, and also counsels them on using behavior change techniques. And then they get connected to this resource in the community, which could be a variety of different things, from cooking classes to dance classes to finance lessons to nature time. And then there's a kind of a closed loop in that they then report back to the link worker or, you know, the referrer, the primary healthcare provider or clinician about how they're doing. And I'm going to talk about this a bit more when I speak about nature prescribing, which I'll get into very soon. But in some ways, we can, as clinicians, be both the healthcare provider and the link worker, because in many cases, you actually don't need kind of a specialized person to help the patient determine how to connect to nature effectively. Okay, so now I'm going to get into the main part of our conversation, which is nature prescribing. And so, as Hussein mentioned, I'm Director of Park Prescriptions, or PARX, for the BC Parks Foundation. And we launched this program in the province of British Columbia first in November of 2020. And since then have spread to every province across Canada, finishing up with Newfoundland and Labrador in June of 2022. And so it's, anyway, just grateful for the advocates across the country who have allowed us to do that. So I want you to take a moment, and you can actually put this in the chat or just think it to yourself, and express in one word to describe how you feel when you're outside in nature. I'll just give you a minute to do that. A lot of people are saying peaceful and calm, refreshed, zen, depending on the temperature, and inspired. These are great words. Someone wrote happy. So this is a really common experience, I find, no matter who you are. If you're a healthcare professional or if you're an everyday member of society, I often ask these questions, and the same words, similar words pop up every time, from calm and peaceful to grounded, restored and happy. So we have this intuitive sense that we feel better, we feel more focused and happier and calmer when we spend time outside connecting to nature. And the great thing is that this is backed up by evidence. So there are hundreds of studies, if not, verging on thousands at this point, several decades deep, that delve into this question of how good nature contact is for us. And so these are just two infographics that I was given permission to share long ago. One of them is from the Canadian Mental Health Association and another from a group in the US. And from improved bone density to reduced risk of non-communicable diseases like diabetes, heart disease, and high blood pressure, to reduced stress, anxiety, symptoms of ADHD in kids, less use of pain medication, and sooner discharge from hospital after surgery. Also better work satisfaction. There are a huge number of benefits of nature time, being around nature and just having nature in your everyday, in your environment, to our health. And so a lot of us would wonder, okay, we're trained in science. A lot of us have degrees in biology or other kinds of life sciences. And the question is, well, how is nature causing these outcomes? And there are a number of different theories, from psychological theories like attention restoration theory and stress reduction theory, that speak to how nature is this source of soft fascination that kind of resets our powers of attention because it's interesting but not stressful to kind of have to navigate around all the urban stimuli, to the fact that there are, in fact, volatile organic compounds that you smell when you're in nature. If you imagine the smell of a cedar forest or a pine forest on a warm day, you're smelling what's called phytoncides, which are actually kind of chemicals that plants make to deter insects. But in some experiments, in vitro and in vivo, they've been shown to boost immunoprotein and natural killer cell function. And then also there's the probiotic aspect. So being exposed to healthy bacteria that then direct our immune systems in healthy ways away from kind of allergies and autoimmune reactions to kind of adaptive immune responses that fight off bacteria and viruses and fungi. So I just want to talk about a few of my favorite studies that have to do with nature contact and health. And I like this one because it really compares two things that we know are major factors in our health status to something very measurable like tree cover. So this was a study in Toronto that combined high resolution satellite imagery, individual tree data, and Ontario Health Study data and self-reports of health perception. And what they found was that 10 more trees per block improved people's health perception, similar to an increase in their personal income of $10,000 per year. moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So this is a study that's gotten a lot of attention because of the fact that it compares, again, something measurable like tree cover to these factors that we know improve our health. So that's cool. And it's also homegrown, it's from Toronto. I like this study because it speaks to nature as medicine, which we have to be careful about because we don't want to medicalize contact with nature. You don't need a doctor or a nurse to prescribe nature. If you want to head out yourself, you totally can. But sometimes people need a bit of an extra push. So this study looked at kids in Chicago, 17 kids with ADHD, so like a fairly small study. And they guided them on 3 different 20-minute walks through a city park, through a downtown area, and through a residential area. So the same kid on all 3 walks. And what they found was that the 20-minute walk in the park improved their digit span backwards performance, similar to levels in children without ADHD. So the DSB test, some of you may know, you recite a sequence of numbers, and then you get the subject to report them in backwards order too. The more numbers you can report, the better your attention and memory. And so this is interesting because it separates out the effective activity, which you think, okay, you're heading outside, you're exercising, of course you're going to feel better. But in fact, it was the park walk that only significantly increased their DSB score to the level of kids without ADHD. And in fact, when they crunched the numbers, they found that this effect of the 20-minute walk in the park rivaled the peak effects of prescription stimulant medication like Ritalin, which I think is really interesting. Of course, no one is saying that a 20-minute walk in a park is going to replace everything that prescription stimulant medication does, but I think it speaks to how powerful nature can be as an adjunct to what we traditionally prescribe or recommend in our practices. Okay, poll number 1, a bit of audience interaction here. So, because again, we're healthcare professionals, many of us are physicians, and when we prescribe something, we often prescribe a dose. And the amazing thing is, in the last few years, this information about dosing has come out. So the question is, how many hours or minutes or whatever in nature do you need each week to report significantly better health and well-being? So go ahead and choose your answer.
Just let me know when you want to close the poll and then we can share the results.
Sure, we're getting up there.
Getting up there.
It's almost like an even split between 1, 2, and 3. Oh, and okay, let's close the poll. So most people answered 1 hour and 3 hours. And this is so interesting, I find, because in fact, when I have asked this question to other audiences, they normally guess the right answer. So anyway, the actual answer is 2 hours. So this comes from a study that was done in the UK. So they did a study of almost 20,000 adults in England, and they asked them how much recreational time in nature they spent, and they controlled for a number of different factors like health status, income, how much nature they had already in their environments. And they found that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 120 minutes per week. And those positive associations continue to build until about the 5-hour mark per week. So that's why we have a standard recommendation in our program that people spend at least 2 hours in nature each week. And I think given that the recommendation for exercise is 2.5 hours per week, I think we can easily see how we can fit this recommendation or prescription for nature into those, into that, because it just, anyway, I think it's very elegant how the 2 numbers are close together and how you can make sure that some of that exercise happens outdoors. Okay, poll number 2. How much nature time do you need each time? And this is a little more controversial because even 5 minutes in nature can improve health outcomes, but we're wondering what gives you the biggest bang for your buck, in terms of those health outcomes. So the most efficient drop in cortisol levels happens between how many minutes in nature? Is it 5 to 10, 10 to 20, 20 to 30, 30 to 60, or 1 to 2 hours? What do people think?
Still
it's interesting. Again, kind of like an even split between those 3 middle ones. Although 20 to 30 looks like it's starting to win.
Okay, I think
let's end that. So yeah, the majority of you were right this time. So in fact, the answer is between 20 to 30 minutes. And this comes from a study that was again released in 2019 that looked at how quickly cortisol, or the primary stress hormone, drops at different lengths of time spent in nature. So they asked 36 urban dwellers over the course of about 2 months to have a nature experience in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more. And then they measured their cortisol levels at certain intervals again, anyway, just to see how steep the cortisol drop would be after certain amounts of minutes in nature. And what they found was that their cortisol or stress levels dropped over 20% more after a nature experience compared to a non-nature experience. And in fact, the efficiency of that drop was the greatest between 20 to 30 minutes. And so that's why we say we have a recommendation in our program that you try to spend at least 20 minutes in nature each time to get that biggest cortisol or stress drop. And again, any amount is better than none, but I think it's also kind of convenient, 2 hours a week, at least 20 minutes each time. It's easy to remember, which is something that's also very useful when you're making a clinical recommendation. Okay, and a lot of people ask, well, why is the BC Parks Foundation, which is kind of like an organization that's focused on conservation, why are they launching a nature prescription program? Because PARX is a program of the foundation. And in fact, it's because health is a really effective message. And we can take some of these lessons from research around climate change, around messaging. So this was a study that did surveys with over 7,500 participants in 5 countries across the world. And they asked these participants to read 5 pairs of statements and ask them which statement, so like economic framing or health framing or environmental framing or migration framing was another one. Anyway, which would make them more likely to support policies tackling climate change. And they found that for the average person, using a health frame and an environment frame increased support for that policy proposal. Economic framing had no effect, which is really interesting because when you think about the messaging we hear from the government, it's always economy, economy, economy. The average person actually cares about health and apparently in the environment more than the economy. Opportunity framing, so these are all the benefits, the positive things that will happen if we do this thing, increased support more than threat or negative framing, and also focusing on present impacts were more motivating than future impacts. And when you look at the starred words, those in fact, so the health framing and the opportunity framing were the only ones that increased support among people who weren't concerned about climate change at all. So that's what we try to do in our program. And that's what we should all try to keep in mind when we're advocating or speaking about planetary health, especially to the public, is focusing on current health impacts and the opportunities in public policy messaging, because it's much more motivating to the average person to change behavior and get them to support policy proposals. And one of the reasons why I spend so much time on nature prescribing, not only because, you know, my family used to call me a tree hugger when I was little, and I've loved nature my whole life because it's been a source of solace, is because connecting people to nature and having more nature in our environments is good for the planet too. So I mentioned before that healthcare is a major contributor to global carbon pollution. Anything that makes people healthier is going to reduce the burden and the carbon pollution of the healthcare system. We also know that having more nature in our cities from an infrastructure perspective makes them healthier too. I'll get into that a bit more on the next slide. And it's also shown by research that kids who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. So this effective nature connection and pro-environmental behaviors and beliefs extends across the lifespan. And so people who are more connected to nature don't only, you know, support conservation because it makes sense that you protect what you love, but they also tend to recycle more. They tend to conserve more energy. They tend to vote in more climate advocates and engage in more other forms of climate action. So I like to think that every time one of our prescribers across the country writes a nature prescription and connects a patient and their family to nature, that they're doing something for the planet at the same time by building this body of pro-planetary health advocates. I like to think that. Also, the executive director of the UN Environment Program has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. It is estimated that if we fully embrace nature-based solutions for climate change that focus on restoring and expanding nature while dealing with human and social issues at the same time, that this could get us over 1/3 of the way towards our 2030 Paris Agreement targets. Right now, globally, the number is probably under 5% in terms of overall climate investments that are made into nature-based solutions for climate change. So if you think about this over 30% potential and this 5% actual investment and the impact that our trusted health our trusted health voice could have on closing that gap, I think that's another way for doctors, nurses, healthcare professionals to be getting out there and talking about how good nature is for our health, both, contact with nature, but also more biodiversity in our urban infrastructure and in our environments. A little bit more about the benefits of green space and trees for urban infrastructure. So this graphic is a map of heat during hot events within the Lower Mainland of Vancouver, unfortunately, which are happening more often recently. And we, many of us know, almost everyone knows about the 2021 heat dome that happened from June to July of 2021 that killed basically over, it depends on, whose estimates you listen to, but over 600 to 700 people in the space of under a month, within 2 weeks. And it's a fact that people who lived in the downtown east side here, which you can see in this kind of upper middle area that's red, not coincidentally, was one of the areas of the Vancouver Coastal Health Authority that has the least amount of tree cover and the least amount of green space. And therefore, because of the lack of shade and the urban heat island effect from all those hot artificial surfaces, it was physically hotter than many parts in the Lower Mainland. And so the majority of hospitalizations in Vancouver Coastal Health during the heat dome, in fact, came from the downtown east side. And so when we look at what trees and urban greening do for us, they, shade reduces the need for air conditioning. And in fact, shaded surfaces are up to 25 degrees cooler than peak temperatures of unshaded ones. They lower energy demand, which reduces air pollution and greenhouse gas emissions. So if you're in an area of Canada where the grid isn't fully, almost completely renewable, like we are in BC, if you increase energy use, you're often going to be increasing burning fossil fuels and air pollution. Green space and trees also remove air pollutants. They sequester carbon dioxide. They also reduce flooding, which is a major issue that we had just about a year ago. That was, I think, the most costly extreme weather event in Canada's history, when, again, the Lower Mainland was literally cut off from the rest of the country by flooding. Anyway, also it's estimated that every $1 invested in a tree returns up to $3 in benefits. So I know, economic arguments don't work for the average person, but when you're speaking to government, it's actually cost effective to invest in more urban greening and trees. I want to talk a little more about this rule called the 3-30-300 rule, because you think about, when you're advocating to decision makers about nature in our spaces, this is an easy rule of thumb to remember. So this rule was coined by my colleague, Dr. Cecil Konynendijk, who used to be in the Department of Forestry at UBC and who's now working in the EU. And this 3-30-300 rule says that we'll know that our urban spaces are healthy from a green space perspective when everyone can see 3 trees from their windows, when there's at least 30% tree canopy in ecologically appropriate areas of the world, across neighborhoods, so not just in wealthy neighborhoods, which tend to have the most green space right now. So there's a major issue with tree and green space equity. And also when everyone is within a 300-meter walk from a high quality urban green space. And there's in fact research to back up these numbers. But the most compelling research, I think, comes from some colleagues that we have in Australia who have looked into this 30% tree cover number as compared to, lower amounts of tree cover. And they found that neighborhoods, again, after controlling for a number of different confounders, that have 30% tree cover reduce their risks of diabetes, heart disease, high blood pressure, psychological distress, poor sleep, and loneliness significantly when you hit that 30% tree cover mark. And there are a number of different hypotheses, again, as to why this might happen, in that green space and trees facilitate this social cohesion and connection and make you reduce your stress and make you more social. And also people can socialize more in these areas because they're more friendly to hang out in. Anyway, but I think this is really interesting, these studies that are coming from the US about the specific target of 30% tree cover. So moving on to one of my favorite topics is our nature prescription program. So if you're inspired to connect patients to nature, I'd encourage you to register to prescribe nature. If you're within Ontario, at parkprescriptions.ca. And if you're within Quebec, we have a French language version of our program that's prescritnature.ca, and you can register to start prescribing nature. It's actually a really easy process. And what I'm really proud of is that, since we launched our program just over 2 years ago, now across Canada, over 5% of all practicing physicians in the country are prescribing nature. which I think is pretty incredible because, as we know, physicians tend to be fairly conservative in how they adopt new practice, new practice innovations. So I think, anyway, 5% of my colleagues is incredible. Within BC, we actually have over 15% of all physicians in our province enrolled, registered in our program, and the numbers just keep growing. So when you register in our program, you'll receive a customized nature prescription file with our standard recommendation for nature time on it, which you can see on the left-hand side. And then you also have access to a number of different evidence-based resources that make it easy and efficient for you to prescribe nature to your patients. So this is an example of one of our 14 different fact sheets that are broken down by different health conditions that cite the evidence and also the recommendation for nature time, and then also how to make the most of your nature prescription, ways to increase the success of your green time. So we're starting to get some international attention as well. So in 2021, the World Health Organization specifically named PARX as only one of 2 case studies from North America cited in their COP26 special report on climate change and health. They specifically mentioned that it was an effective way to protect and restore nature as the foundation of our health. And this was really the first time, I think, that we were recognized internationally. And then that attention really exploded earlier. So last year now, I guess we're in 2023, at the end of January, when we announced our collaboration with Parks Canada, where patients can prescribe free Parks Canada Discovery Pass, prescribers can prescribe to patients free Parks Canada Discovery Passes to reduce one barrier to nature access, which is day use fees in parks. And I want to underline that that's not the whole focus of our program. We're also trying to increase people's connection to nature in their everyday environments. So some people kind of have this misconception that it's just a national park prescription program. It's not, but that's definitely what gets the most attention. But I think it's really cool how through this collaboration that we as healthcare providers can tangibly reduce this barrier to nature access. So we're not just writing them a prescription, we're saying, and here's how to make it easier. We also have partnerships with different nature venues and experience providers, mostly within BC. So for example, UBC Botanical Gardens and UBC Nitobe Gardens, and other gardens around Vancouver, where if you show your nature prescription at the gate, you can get free or discounted admission. So we're trying to expand these partnerships across the country. And so this really set off a wave of global attention, and in fact led to something that I'm incredibly proud of. At COP15, the Canadian Medical Association formally recommended nature prescribing in their environmentally sustainable health systems in Canada policy that was released in October. So the first national physicians organization in the world, association in the world, to formally recommend nature prescribing in policy. And also the Canadian Medical Association officially announced their endorsement of PARX at COP15 in Montreal. And so I think this is incredible because nature prescribing, the importance of nature for our health, was already being mainstreamed within our profession, but to have the support of the CMA and also Health Canada, Minister Duclos, our federal health minister, recorded a really nice video supporting our program as well. I think it's just, the next move in terms of socializing this idea that nature prescribing and nature are good for our health. Okay, so I'm actually going to show you a video, and the video is a case study. Before I talk about these next steps, is a case study of a patient, one of the very first patients who was prescribed nature in our program. And I think this is one of the major reasons why I do this and why many of our colleagues do this as well, is because it actually improves people's health on an individual level. We've had so many positive anecdotes from both patients and prescribers about how this nature prescription and connecting to nature more often has improved their health in tangible ways. And so I just want to share this video from Marjorie, featuring Marjorie, one of our patients who was prescribed nature by one of my colleagues. Oops, actually, I think I need to enable the audio here. Oh, here we go, share sound. All right. And this is her story as told by CNN.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh, goody, one more pill. And he says, no. I want you to spend 2 hours during the week, outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75, so I've got to tell you that I'm 91. So that's why she takes care of me.
I try. I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. Park Prescription, or PARX, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with Parks Canada where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these Parks Canada discovery passes that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, "You're absolutely right. When I spend more time in nature, I feel better." And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life. Whenever I watch that video, it makes me smile because I think Marjorie is just so compelling. Okay, back to, oops. Okay, I'm gonna go back to my presentation now. Oops. Okay, so in terms of next steps for our program, we're fully aware that this program needs to continue to grow. We need to continue to reduce barriers to nature access. We are planning to launch PARX in the territories, hopefully sometime in the first half of this year. We've also been collaborating with a number of different organizations, from transportation and to nature-based organizations, to further reduce barriers to nature access. So if you happen to have connections to any of these kinds of organizations, please connect us, because we are a national program. And very soon, we're going to be launching the PARX app to help patients track and incentivize nature time. Okay, so in terms of, just to sum up here, our key messages are that prescribing and spending time in nature are simple and effective interventions for improving patient and planetary health. Urban green spaces and tree canopy are essential for health. So remember the 3-30-300 rule. And this is something that we often do. Again, we don't just prescribe nature, we're trying to reduce barriers to nature access. Part of that is advocating to decision makers on provincial, federal, and municipal levels, typically municipal, because they often make more of the decisions around urban green space, to make sure that they prioritize green space and tree cover in their urban planning. And so finally, there's an established and growing body of health professionals prescribing nature across Canada. And if you feel inspired, again, please join us in doing our work at parcprescriptions.ca or prescreennaturel.ca if you know colleagues in Quebec. Thank you so much for listening.
Hey, that was awesome, Melissa. Thanks so much. And I know you said I gave you an over-the-top introduction, but after watching that presentation, I think everyone understands exactly why. So I'm hoping we'll get some questions. I'm sure people have a lot of questions, but since I'm moderating, I get to ask the first one. So, listen, this program, it's made it. I mean, it's on CNN. You've been on the cover of like Mass Gen's like Hospital magazine, like it's, if there was ever an idea that went from start to like really kind of spreading and scaling, this is an example of one. I'm wondering, a lot of us, like, I don't even have aspirations to do something like that, but a lot of us are just starting out. How did this start out for you? And like, could you tell that part of the story a little bit? Like, was your vision at the beginning to, was it all this, or did that vision kind of morph with time? Like, what advice, based on, again, your story, if you could share that a bit, do you have for those of us who are just kind of trying to do anything?
It's really important that you have a team. So I want to emphasize that I could not have done this. We could not have done this without support from clinicians across Canada. Like it is so important to have local champions. I mean, if there's some doctor in BC trying to contact someone in New Brunswick and get them to support a nature prescribing program, it's not going to work. So in fact, the network that CAPE provided, with having regional committees and health professionals registered across the country, was indispensable, because they get it. They get that spending time in nature and conservation are important for patient and planetary health. So they were so enthusiastic to move that forward. So that's number one, is find the right people to help spread your message, find those champions. But in terms of how I happened into this, it was when I had my own nature deficit experience, essentially. My first job was as a full service rural family doc in northern BC, and I was immersed in nature. Like, there were literally bears and deer walking across my driveway, every week. And I could see mountains out my front window. And then after a year or two of living and working there, I moved to downtown Toronto. And then suddenly my view was like concrete and glass, and like no bears, no deer, no trees. And I felt more stressed. And then every time I would go do a rural locum, I would think, okay, this work is harder, but I feel less stressed. And then I eventually realized it was nature deficit for myself. And I'm not saying everyone has this, different people have different levels of sensitivity to their environments. But I really felt it. And so I dove into the evidence base behind the health benefits of nature, and found there actually was research behind it, which I was shocked to find, because I thought, wow, people are asking this question. I had no idea. And as a physician, it doesn't exist unless it's backed up by RCTs or whatever, right? So I thought, wow, this is so compelling. And I thought, no one's talking about this. And this was like 12 years ago now. And I thought, I need to make it my mission, to make sure my colleagues know about this. And so I just started small. So I started writing about it for Evergreen. It's this kind of urban greening based organization based in Toronto, writing blogs about how nature was good for health, again, because no one was talking about it. And then people started noticing that, and then started inviting me to speak about it and whatever. But it was really moving from Ontario to BC at the end of 2015, and then eventually connecting with the BC Parks Foundation when they started operations in 2018, and that launched this whole program of this national nature prescribing initiative. Because I had this idea, I'd heard about colleagues in the US and elsewhere prescribing nature, but I'm like, how am I going to do this? I'm like one family doctor. Like I don't have the network to make this happen anywhere. And so they wanted to do it. And so with staff, some funding from their endowment, they dedicated staff and time to making this happen. And so, we put together the website together, we came up with the ideas behind it, but it was really those connections through CAPE and with colleagues across the country that made the national rollout happen. So it was definitely not all me. It was just, I happened to be right place, right time, and had a passion for it myself. And that's what I think it takes, is just like, working away at it, finding the people who are interested in it too. And just letting your passion come across for it too. Like, obviously I'm super passionate about this topic. and sincere when I talk about it. So find your passion, and then, other people will find it compelling and join you.
That's awesome. No, that's great. And actually, on that note, there was a question from someone just asking, what's required to sign up for the Parks prescription program?
Yeah, you just have to be a regulated healthcare professional within Canada. Well, within the 10 provinces, because we haven't launched in the territories yet. But you just go to our website, you click get started, and it's super simple. You just have to enter like your email address, your name, and your practice address, whatever. And then we will get in touch with you with your nature prescribing little digital kit, and you can start prescribing nature right away. Yeah, it's not hard.
Cool. So maybe I'd be interested, one of the questions here is, are there pharmaceuticals or other therapies you now prescribe less often because you find you're prescribing nature instead? And also, to build on that question, there'll be your own personal experience, but are you aware of any studies like that have shown, like, with adoption of this, do you see a decrease in pharmaceuticals?
Yeah, this is a good question. This is a question that's often asked, is prescribing nature instead of, and I want to emphasize that it's not instead of, it forms part of a treatment plan. So if your patient needs antidepressants or blood pressure medication or whatever, please prescribe it, but also prescribe nature too. So we often say that we view nature as the fourth pillar of health, just as important as healthy diet, adequate, good quality sleep, and exercise at maintaining a healthy lifestyle. So when you're doing that lifestyle counseling, just slide in a question about how much time do you spend outside, and you can easily, make that recommendation, preferably prescribe it, so you can connect your patient to the benefits. But it doesn't have to add that much time. But anyway, yeah. But in terms of actually seeing reductions in like use of medication, I have to say that, no patient that I prescribe nature to hasn't improved. That's a weird negative, double negative way to express it, but they've all gotten better, and sometimes I do prescribe it with an SSRI or whatever. And I'm not saying it was the nature, but that combined with the support, with the medication, with doing something for themselves and giving themselves permission to do something that's good for themselves, I think made the difference. And in terms of the evidence base behind nature prescribing specifically, it's pretty new. So there's a ton of evidence. I think the evidence behind the health benefits of nature contact is pretty slam dunk, but the prescribing aspect, we're working on that. So they're not announced yet, but actually 2 major international grants, one of them, I think it's almost £7 million or something, and another good $1 to $2 million Australian grant were just approved, looking into this very question about nature prescriptions and their efficacy. And I'm PRX is a international advisor or co-investigator on both of those. So we're planning to contribute to that evidence base, but it's just not big enough yet because it's so new.
Cool. Yeah, and there's some, comments section here is blown up a little bit, and there's a comment saying it'd be interesting to compare those who comply with those who don't comply. Have a study out there and publish it in CMAJ. Certainly, I think the word is getting out there, but, interesting comments about research. There's a question here saying that, there's obviously the cost to entrance into a park, but then if that's an issue, then maybe there's issues with transportation costs to the park as well. And so are there any links being made to help people get to the parks?
Yeah, and that is a barrier that comes up frequently when we speak with community members about what's preventing them from accessing nature is transportation. So I'll come at that from 2 angles. So one, yeah, absolutely. The BC Parks Foundation has had some conversations with TransLink, which is our TDC or OC Transpo or whatever. And also Park Bus and Evo and different, which is a car share company out here on the West Coast, to see how we can, again, somehow reduce barriers to nature access. For example, giving people a free transit fare to Stanley Park from a relatively less nature-rich area of the city. So these conversations are happening. They take a lot of time when you're dealing, especially with big bureaucracy and government, but we're thinking about it for sure. I will say that the BC Parks Foundation, through their Healthy by Nature program, they run these outside and unplugged events where they bring people often from nature deprived areas of the city or new Canadians who don't have that great access to our provincial parks. We've partnered with Park Bus. I think Park Bus runs in Ontario as well. They often take people to provincial and national parks, where we just bring them and give them a nature experience, working with different sponsors to help subsidize their fares. So there's a lot of room for the transportation piece. I think we have to keep in mind though that if you're sitting in a car and you're driving yourself and two people and burning fossil fuels, that might not be the best thing. So, more group transportation would be better. But yeah, definitely we're thinking about that question all the time.
Awesome. Thank you for that answer. And there's lots of thanks in here for lots of different things that your presentation and also for your answers. I have a question here from one of our medical students, Niev Seguin. Our medical student population is super involved and has done lots of great stuff. So really kind of leading the way for the rest of us. So her question is, what are the challenges, bureaucratic hurdles, that you came across when trying to implement this, and how did you overcome these hurdles?
What's funny is because of how the amazing advocates we had, there were some hurdles, but it wasn't that hard. I think once you had major medical and nursing associations within BC and then Ontario endorsing, it was okay, well, they're endorsing, why shouldn't we, right? So it was just a matter of making those connections. But I have to give credit to BC Family Doctors. So Dr. Renee Fernandez is still the executive director. She's a family doc, and I approached some other physician organizations. Pretty obvious who it is, I guess, because there aren't any other major physician associations in BC. And because of a number of different, bureaucratic reasons, they couldn't endorse. But Dr. Fernandez saw the benefit of it, and she said, absolutely, I'm on board. And then once they were on board, then we could say, well, look, this doctor's organization is endorsing. Then we got the nurses on board, and then it just kind of continued from there. But I think a really important ingredient was having that national network through CAPE, and having local advocates. And even when it comes to media, people don't always want to, some a media organization in Nova Scotia doesn't really want to talk to a doctor from BC. They want to talk to a local practitioner, a local prescriber. And so having local advocates also is really important to get the message out to the media locally.
So again, we've talked about advocacy. One of the big advocacy groups for that include physicians, and you've mentioned them several times. You're the president as well of CAPE. Not everyone may be aware of what CAPE does exactly. And, again, a lot of us here are just starting out. Is CAPE something where you need to know a lot to join, that if you join, then, there's an expectation you're going to show up at a rally and hold a sign or something maybe you could fill people in on CAPE, maybe, how people could get involved, etc. I think it'd be good for people to hear about that.
Yeah, well, CAPE's overall mission is to protect human health by protecting the planet. And it's been really great because over the last probably 2-3 years, we've established chapters in every province, which is wonderful because you can start to advocate on issues and projects that are important to you. And so I'd encourage you, if you're interested, to get involved in your, I'm assuming, Ontario chapter. And then you can start learning. So when I joined BC CAPE, so I moved to BC at the end of 2015, I think I started working with him in maybe 2016 or 17. I knew nothing. To be honest, nature and health was my jam. I didn't know anything about climate change or fracking or whatever fossil fuel stuff. In fact, I'd in fact avoided it because it seems scary and not as happy and shiny as nature. But then, I just connected with them, started attending the monthly meetings, learning more, and then eventually learned more and used the skills that I had to start pushing that message. And I think, this speaks to how connecting to nature makes you more likely to engage in pro-environmental behaviors. Because I've heard from other people who joined CAPE is their in was the nature health thing. They thought, hey, that's a really cool project that, CAPE is involved in. Maybe I should join the regional committee and get more involved in other initiatives that protect the planet. So I think it's a very friendly space for people to join. And then hopefully, like it did for me, it'll crack open the door towards bolder, or more involved climate action, but it doesn't have to, like everyone has a different bandwidth. Everyone has a certain amount of energy and space in their life. And if prescribing nature is like the planetary health action you can do, that's great. It's better than not doing anything. So I think being connected to your regional committee is a great way to start getting involved and learning about what CAPE does.
Cool. So we have 3 minutes left. There's a comment here saying, do you think it would be worth publishing an opinion piece in the Globe with respect to there's, Moraine Lake, there was that article recently barring private vehicles and whether or not you could get an exception for those with prescriptions. So there's, I don't know, there's a comment there about, would you consider publishing an opinion piece with Andre Picard maybe to write an article?
About Moraine Lake specifically, or
or maybe getting an exception for those with the nature prescription to get access, preferential, be like the VIP list, I guess.
I actually don't know much about Moraine Lake or the issues around that, so I'd have to kind of educate myself about that. But can non-private vehicles go in there? Like, what's the issue there?
Yeah, I'm not sure. I don't know if Richard wants to comment more on it. I remember seeing the article, but I don't know the details. So.
Yeah, I'll comment on that. No, I meant writing an article just on the benefits of nature on health. I'm not talking about just specifically Moraine Lake. That would be a very limited audience. But I think if you could write an article just that really addresses what you've been talking about today, so that everybody across Canada could benefit from that. And since the Globe or even the National Observer, whichever, they're widely read and it would have a lot of impact.
Yeah, we have published some pieces for sure about the health benefits of nature. I think the CEO of the BC Parks Foundation, shortly after we launched, published something in the Vancouver Sun. The Globe is hard to get op-eds into. We've tried a few times. We'll continue to try. But yeah, for sure. There's so many different ways to increase awareness about the health benefits of nature.
The National Observer has 16 million readers. You can try that too.
Mm-hmm. Yeah, they're generally pretty friendly at accepting things that we write. So yeah, definitely. We're always working on getting the message out.
Awesome. So that brings us essentially to 6:30. Again, Melissa, I just, really want to thank you again for spending time. I know how busy your schedule is and how demand you are to give talks. So I really appreciate you taking the time to speak to us today. I know I can speak for everyone. Usually I don't speak for everyone, but I think I speak for everyone here saying we're really inspired by all the different things you're doing and kind of looking forward to seeing all the different things you continue to kind of do for nature and for the planet. It's really cool to see how like all your stuff is kind of just blowing up all over the place. So it's really cool. Just before we finish off, just a bit of boring stuff here, but important. Remember, we do have this community of practice. We have our Bright Space. We invite you to, leave some comments on there in terms of a reflection. You've seen what like one person's and obviously working with a team and a network, but an idea born out of passion, it can get you on CNN. And so, and that's how we measure success really, right? So not at all, but I think it's really cool. And so next time we actually do have like a change implementation kind of talk. And so we're hoping you'll bring some of your ideas. So it'll really frame that lecture or webinar really well. And then, you saw the swag there. If you kind of do all this stuff, then on your lanyard, you have a little pin to say, you've done the planetary health webinar. And so, again, we really appreciate all of you attending this. If you have any feedback, we want to hear about it. Please fill out the eval for this at the end of it should pop up automatically for you. And again, Dr. Lem, I don't know what else to say, but thank you. And again, thank you to all of you. And I hope all of you have a great evening. Take care.
Thanks. Bye, everyone.